Another abstract being presented from our group was the real-world analysis of patients with multiple myeloma that received daratumumab as monotherapy for relapsed multiple myeloma. And this was presented by one of our clinical fellows, Jessica Taub, on behalf of a number of different groups within the UK. So daratumumab monotherapy is licensed and indicated for patients with multiply relapsed multiple myeloma based on some early phase data, namely this Sirius clinical trial. Now, most centres in the world will be using daratumumab in combination with other agents, but it does have a role as monotherapy and is more cost effective in that role. So we investigated this as it is currently standard UK practice for use as fourth line. And we looked at about 95 patients who are treated with this modality. This is a real-world data set, so we took all patients, regardless of their performance status, their blood results, and their different demographics, or indeed cytogenetic risk. What was interesting and probably reassuring is that the overall efficacy data was actually quite similar to the trial data. What we see is an overall response rate of almost 40%, which is very similar to the Sirius clinical trial, and a median progression-free survival of almost 5 months. So again, this is all very much in keeping. But one of the advantages of the real-world data sets is that we can look at subgroup analysis of more clinically relevant indicators. So for us, one of the big questions was, if you had a patient with high-risk disease, is daratumumab monotherapy really going to be sufficient? Because we do have other treatment options available. And what we do find is that those patients that didn't do so well were those patients with adverse risk cytogenetics, or those patients with extramedullary disease, and they had an inferior progression-free survival. And so I would suggest that if you had a patient with those features, that you might want to consider a different treatment where you can give combination therapy rather than a monotherapy. And then finally, just looking past daratumumab as fourth-line therapy, the question is what happens afterwards? Because what we don't know at fifth-line therapy are, do these patients still go on and get a meaningful response to subsequent treatments? The good news is that most of our patients did receive pomalidomide combination treatment, and they had a median progression-free survival of over 5 months. So that shows that patients are still able to go on and receive subsequent treatments. But just stepping back from this whole thing, you can look at the overall outcomes of patients at fourth and fifth line therapy. And what you're seeing in the UK is that median progression-free survivals are in the region of 4 or 5 months, which is reasonably good, but actually we've got a lot of work to go for patients at fourth and fifth line therapy. And that's really where we need to focus on some of these immunotherapies, because I'm sure we can do a lot better for some of these patients.